This is Stuart Reed for WHCR 90.3 FM in New York, broadcasting from the City College of New York with our COVID-19 coronavirus update. This report is provided by Harlem Emergency Network, WHCR's emergency broadcast team, Manhattan Borough President Gail Brewer, and the New York City Mayor's Office. All non-essential businesses in New York City are to be closed. Only businesses with essential functions will be permitted to operate. Examples include grocery stores, pharmacies, internet providers, food delivery, banks, financial institutions, and mass transit. Businesses that provide essential services must implement rules that help facilitate social distancing. The NYPD will be out in neighborhoods across the city to ensure compliance with these policies. And don't forget, every drastic step we take now to reduce exposure to COVID-19 saves lives down the road and preserves our healthcare system staff and infrastructure to better handle not only virus cases, but regular medical emergencies like delivering babies. Speaking of which, public hospitals are allowing healthy partners in delivery rooms during birth. New York City parks and playgrounds. Yesterday, Mayor de Blasio warned city residents that there is still congestion in city parks and playgrounds, and that families should stay at least 6 feet apart from other families and individuals. The mayor is assessing resident compliance and will announce on Saturday whether it is necessary to close city parks and playgrounds. For all updates on park service changes and closures, go to nycgovparks.org. That's www.nycgovparks.org. The city is also considering closing at least 2 public streets per borough to vehicular traffic in order to allow more outdoor space with proper social distancing for families and individuals. Parking. Alternate side of the street parking rules remain suspended through Tuesday, March 31st, at which time the city will assess the need for street cleaning and temporary reinstatement of the rules. Hospitals and testing. City hospitals like Harlem Hospital Centers are not accepting appointments anymore to test for the coronavirus. If you feel you need to be tested, call any city hospital call center, and a clinician will tell you if you need to stay home or if you need to go in for testing. Tents are set up outside many city hospitals to test those who already have made appointments. Jails. The city is reviewing the 5,000 inmates currently incarcerated by the city on Rikers Island to identify those over 70 years old and or with pre-existing conditions to consider their release. The mayor has ordered the immediate release of 300 inmates and is reviewing other cases for release consideration. Support groups and relief. The United Way has established a COVID-19 Community Economic Relief Fund. They will help with bills, rent, and food. Call 866-211-9966 and give them your zip code. That's 1-866-211-9966 for help with your bills, rent, and food from the United Way Community Economic Relief Fund. First Responder Child Care. On Monday, the Department of Education opened regional enrichment centers, or RECs, for children of healthcare workers, police, fire, emergency management, and some transit workers. RECs will be open Monday through Friday from 7:30 a.m. to 6 p.m. Students will be provided 3 hot meals a day and technology for remote learning, as well as art and PE classes. Each location will include a nurse and isolation rooms in case anyone displays symptoms. There are 15 centers in Manhattan. To apply, go to the website WHCREBT.org and click First Responder RECs in the menu. That's WHCREBT.org and click First Responder RECs in the menu. Food for students. The DOE is committed to making 3 free meals available daily for all New York City children. Families can learn of the location for the nearest meal hub by texting the word food or comida to 877-877. Again, text the word food or comida to 877-877. 877 to find the nearest location for a meal hub. Food for seniors. There's an interactive map for finding soup kitchens, food pantries, senior centers, or SNAP enrollment sites at www.foodbanknyc.org/get-help. That's foodbanknyc.org/GET-HELP. The city's Department of Aging, or DFTA, is phasing in a direct meal delivery system that will gradually replace the current grab-and-go model of food distribution at senior centers. The first phase will begin today, Wednesday, March 25th. Grab-and-go meals will continue at many centers and even overlap as the new system is implemented. DFTA recommends contacting the centers directly before going to the center to confirm timing and availability. The city has created a Get Food NYC free food delivery program for the vulnerable and food insecure. Call 311 for information. Stay informed. To get regular updates on the latest developments with coronavirus in New York City, text COVID to the number 692-692. New Yorkers can also text COVID ESP to 692-692 for updates in Spanish. Again, for English, text COVID to 692-692. For Spanish, text COVIDESP to 692-692. You will receive regular updates on texts with the latest news and developments. If you have any questions on finding medical care, call 311. You can get alerts from Harlem Emergency Network by texting the word alert to 347-918-3540. You can also visit WHCR.org and click on the WEBT tab in the menu for extensive information and tips on how to use natural botanicals to help boost your immune system, as well as links to many of the services and resources mentioned in this report. Again, go to WHCR.org and click on WEBT in the menu for extensive information and tips on how to use natural botanicals, as well as links to many of the services and resources mentioned in this report. We understand that this is a difficult time. We would like to hear about your experiences and help with any questions you may have. So please leave a voice or text message at WHCR's coronavirus line. The number is 347-395-6177. That's 347-395-6177 to leave a voice or text message. Also, you can send an email to WHCRcoronavirus@gmail.com. That's WHCRcoronavirus@gmail.com. As you may know, WHCR is on automated programming until further notice. At the beginning of your favorite shows, we will give regular updates as we get information from local, state, and federal governments about the coronavirus, also known as COVID-19. We're working hard to make sure that we provide you with up-to-date information relevant to you, your family, and our community. On behalf of all of us at WHCR, we ask you to stay safe and check in with each other, especially the elderly and people with other medical challenges. This is Stuart Reed for WHCR 90.3 FM, broadcasting from the City College of New York.